Bismillahirrahmanirrahim. So, a 40-year-old woman, gravida 2 para 1, come to the physician for her first prenatal visit. She is at 10 weeks of gestation based on her last menstrual period. The patient has no medical problems and take no medication. Her husband and 3-year-old son are healthy, but she has a cousin with Down syndrome. Vital signs are normal, urine beta ECG is positive, and fetal heart tones are present. Which of the following is the most appropriate next step and management of this patient? Order plasma cell-free fetal DNA testing, order serum alpha fetoprotein, estrol, beta HCG, and inhibin A levels, order serum pregnancy-associated plasma protein A level, perform amniocentesis, perform chorionic vellus sampling. So in this question, this female patient come to us at 10 week of gestation. 10 week of gestation. She she has no issues, but her cousin having Down syndrome. But her cousin having Down syndrome. So, which of the following is the most appropriate next evaluation of this patient? So, first of all, in this question, we will here the choice A is the correct one. Order plasma free fetal DNA testing, because plasma cell free fetal DNA testing a non-invasive and invasive procedure in which the chromosomal abnormality is detected. I will explain to you that plasma cell-free fetal DNA testing, women, for example, women age more than 35 years or equal to 35 years are at increased risk of fetal aneuploidy and should be offered cell-free fetal DNA testing of maternal plasma. This non-invasive test can be performed at more than or equal to 10 weeks of gestation and has 99% sensitivity and specificity for detecting trisomy 21, which is Down syndrome, more than 92% sensitive for trisomy 18, Edward syndrome, and more than 80% sensitive for trisomy 13, Patau syndrome. It can also identify the fetal sex and detect some sex chromosomal disorder. So here the correct option is option A. Come to the option B. Why option B is the incorrect one? Order serum alpha fetoprotein and estrol beta HCG and inhibin A level. So in the second trimester, the quadruple screen include maternal serum alpha fetoprotein, beta HCG, unconjugated estrol, and inhibin A level. The detection rate for Down syndrome using the quadruple screen is 80%. Choice C. Order serum pregnancy associated plasma protein A level. So patients who do not meet high risk criteria for cell free fetal DNA can undergo screening during the first trimester with the combined test pregnancy associated plasma protein A, beta HCG, and ultrasound nuchal translucency, which has a detection rate of 85% for Down syndrome. Choice D. Perform amniocentesis. So abnormal cell free fetal DNA can be confirmed by fetal karyotyping via amniocentesis in the second trimester. Choice E. Choice E. Perform chorionic vellus sampling. So, abnormal cell-free fetal DNA result can be confirmed by fetal karyotyping via chorionic vellus sampling in the first trimester. So I will explain to you that why the choice A is the correct one. Order plasma cell-free fetal DNA testing once again, because as we know that this patient first of all come to us at 40 year of pregnant 40, because this patient has 40, her age is 40 year. So and she also having the pregnancy, and she came to us at 10 week of gestation. So during 10 week of gestation, as we know that the women more than or equal to 35 years of age are increased risk for fetal aneuploidy and should be screened for chromosomal abnormalities. So here the choice A is the correct one, because order plasma cell-free fetal DNA testing is non-invasive test and which should be ordered first during the first trimester. So here the correct option is choice A.